Hey everybody, Luke Gordon, physical therapist, back here with another video on inversion tables. This one's going to be pretty quick. I just want to answer a really common question that I get in the clinic from physical therapy clients, which is using an inversion table safe? Specifically for things like lower back pain and sciatica. The general answer to that question, or the answer 9 times out of 10, is yes, an inversion table is safe, as long as you are doing it under someone's supervision, or not necessarily someone's supervision, but you are doing it in a gradual process. So I just made another video in terms of how long to go. I've got 2 other videos in terms of how to use the inversion table. So check out those videos too if you need more advice on how to get started with an inversion table, things like that. So for the most people, again, it is going to be safe and oftentimes effective as long as you ease your way into it and don't do anything too extreme, too fast. For example, you don't want to go completely inverted, all the way back from, horizontal all the way back to 90 degrees, so you're upside down. You don't want to do that on day one. Just kind of some obvious things like that, but probably need to be said. The other thing in terms of your safety is that if you have a back pathology, such as you have a fracture in your lower back, you have a pars defect, or you have some level of instability, which will commonly be called like a spondylolisthesis on an MRI report or an x-ray, depending on what you have, or you've had back surgery like a fusion, you definitely do want to check with your doctor, your physician, and or your surgeon for those instances, because there are safe ways to use an inversion table with some of those diagnoses. You just want to make sure that you're in a safe zone, especially if you've had a surgery. You want to make sure that you're fully healed, that you're stable, and that your surgeon feels comfortable. That might also dictate, in terms of your safety, how far back do you go, because going back 45 degrees is a lot different than going back 75 or 90 in terms of how much it's going to unweight your spine and start to pull those segments apart. So again, if you have any serious pathology with your lower back, I would definitely consult a physician first and or your surgeon if you have one. And there are some other random things in terms of like if you have really high blood pressure or you have glaucoma, anything that's the increased pressure to your upper chest or head could potentially cause an issue. I would definitely just get those clear with your doctor as well. So I know a lot of people watching the videos are kind of do-it-yourselfers, which is great, but when in doubt, talk to your physician or your trusted medical person, your naturopath, again, if you have a surgeon, whoever you are working with, and make sure that they approve it, or if you're working with a physical therapist, they should be able to tell you too. Overall, inversion tables are very safe for most people, and they're very effective for things like lower back pain and sciatica, especially if you have degenerative changes in your spine. But when in doubt, check with a medical professional just to make sure that you're doing it safely. So hope that video helps overall. Please leave a comment before you go, and feel free to subscribe. I appreciate subscriptions and comments, and again, thank you for watching the video.